good afternoon. I'm Jamie Bervano and I will be performing the urinary catheterization. So I have here my patient. I will ask her name or initial information about her and if she has an allergy when it comes to povidone iodine and also for the latex. So ma'am, good afternoon. I'm your nurse for today. So I will be performing the urinary catheterization. So, may i-ask lang po ako sa inyo kung may allergy kayo pagdating sa povidone iodine and sa latex po. Wala po. So, ma-ask ko lang po yung pangalan nyo.
Jeremy Aquarium.
Okay po. Ilang taon na po kayo?
21.
Taga saan po?
Pampanga po.
Student po. So, after that, you can perform the initial assessment for the patient to be ready for the procedure that you're going to do in urinary catheterization. Leading to the assessment, the first thing that you need to do is to assess the need for catheterization and the type of catheterization that needed. So I have the catheter size here, which is 14. Then next is you need to assess for the need of perineal care before the catheterization. So I will show you first the materials that I have here. The planning case I have here, which is you need to prepare all the materials and supplies needed for the procedure. So the first thing you need is a sterile catheter of appropriate size. So I have it here, which is size 14, and then on the waterproof pad, which is this one, and then the sterile gloves. I also have it in my box, and also the urinary bag, and then the antiseptic solution, the cotton balls, the water-soluble lubricants, and then then the tape, which is that one, and also the specimen container. Then the sterile drape, the sterile fenestrated drape, this one, and then the syringe is 10 ml. So I have it there, and also the towel and soap and water. So the implementing I got it. So for the then for the rationale of preparing the materials, it is in order to organize materials, facilitate easy access during the procedure. So the next in assessment, you need to assess the perineal care before catheterization. And then, assess the urinary Miatus for signs of infection or inflammation. Ask the client for any history of latex allergy, difficulty of prior of catheterization, anxiety, or urinary strictures. Then, the rationale of that, it is allows the detection of potential complication. Then, after that, you need to assess the client's ability to cooperate with the procedure. Then, for the assess the client's ability to cooperate with the procedure. The rationale of that it is in order to determine the procedure will be carried out. Then assess the working area if it is well lit. And then the rationale it is in order to determine the preparation needs to be done to ensure the successful procedure. Then next is assess for an allergy povidone, or should I say the iodine and also the latex allergy. So the rationale it is to avoid the occurrence of allergic reaction because these materials will be utilized in the performance of the procedure. So for the last in the assessment, of course, you need to watch for indication of distress or embarrassment. So it is in order to determine what teaching or support are needed. So going to the implementation, the first thing that you need to do is, of course, to identify the client and explain the purpose of doing the procedure. The rationale of that, it is to alleviate anxiety and gains the cooperation of the client. So, ma'am, i-explain ko lang po sa inyo kung bakit necessary itong urinary catheterization. So, ang urinary catheterization po ay makakatulong para matanggal ang mga waste products sa inyong katawan katulad ng inyong ihi. So, ang urinary po catheterization ay makakatulong para mailabas nyo at mairaos ng maayos yung pag-ihi nyo. Okay po ba yun? Salamat po. And then, of course, you need to provide the privacy by closing the windows and doors. So, as you can see, the curtains are closed and the door are closed because it is to provide the client's dignity. And then, you need to set the bed to comfortable height to work and raise the side rail on the opposite side. So, the rationale of that, it is in order to promote proper body mechanics and ensures the client safety. Then, of course, you need to wash hands in order to prevent the microorganism to spread in order to prevent the cross-contamination. And then, after that, of course, you need to assist the client to an appropriate position. For the female, of course, supine with knees flexed and externally rotated. So, ma'am, pakisupine lang po ng inyong knees. Okay. What is the rationale of that? It is to relaxes the muscles and allows visualization of the urea to facilitate insertion of the catheter. Then, after that, you need to drape the client's abdomen and thighs Aanin ko lang po yung inyong abdomen. Okay. The rationale in draping the abdomen and thighs of the patient, it is to promote the client comfort and warmth. And then, you need to place a waterproof drape under the patient's buttocks for female. And then, it is in order to avoid soiling of bed linens. So, I will place the waterproof drape So, if you have a coworker, of course, you need to ask to hold the flashlight or place a gooseneck lamp next to the patient beds to provide better visualization of the urinary Miatus. So, before opening the package of collecting bag and which you need to place in the end tubing within reach, because the rationale of that, since one hand is needed to hold the catheter, so once it is placed, open the package while two hands are still available. So I will use first the sterile gloves. So I'm here. I'm placing it in a sterile place. So I have it here, the catheter in 14 size, and of course the 10 ml syringe, including the normal saline. So I'm done in donning gloves, which is to reduce risk of contamination from microorganism. So the next is you will attach the prefilled syringe in the indwelling catheter, inflation hub, and test the balloon. So I have here the catheter in size 14 for adult, and then the 10 ml syringe. So I will open it first. So the rationale of that, if the balloon malfunction, it is important to replace in prior use. So I have here the 10 ml syringe in order to inflation the hub and test the balloon. So of course, I have it here, the urine bag. I will place it here. So after doing the attaching the prefilled syringe, the next thing you will do is lubricate the catheter and 1 to 2 inches for females. So based for my patient, she is female, and then I need to place it with the drainage and inside of the collection container. So the rationale of that, it is to facilitate easier insertion of the catheter. So next is you will cleanse the Miatus with an antiseptic solution. Of course, when your patient is female, the first thing that you will do is you use your non-dominant hand in order to spread the labia. So you need to wipe the labia one side at a time using a new cotton for each stroke. It is to avoid contamination. For the last is you need to pick up the cleansing ball with the forceps on your dominant hand, and also wipe from the center of the Miatus in a circular motion around the glands. Then after that, use a new cotton after each stroke. So once you use one cotton, once you use a cotton, you need to discard it after you use it. And then another new cotton, use it and discard it. So what is the rationale of that? It is in order to clean the Miatus, as it may contain microorganisms that contaminate catheter upon insertion. So thus, it introduces the microorganism to the bladder. So using the betadine, it is in order to prevent the microorganism to spread. So after doing the cleansing part, the next thing is you will do is to insert the catheter, and once the urine begins to flow, advance it further for about 2 inches. So it is in order to be sure it is fully the bladder. So next is you will inflate the balloon in the indwelling catheter. So according to the indicated volume, of course. And then it is in order to secure the catheter into the bladder. Then after that, you need to collect 20 to 30 ml of urine specimen if needed. Then it is in order to get an ample amount of urine sample for a laboratory test. Then after that, of course, you need to attach the catheter to drainage bottle. So the rationale of that, it is in order to have a reservoir of urine of monitoring and drainage. After that, you need to secure the catheter tubing to the inner thigh for females, or the upper thigh or abdomen for male, but as my patient, she is a female, it is in order to secure the catheter and avoid sudden dislodgement. And then last is for the implementation, you need to hang the drainage bag to the bed below, which is here, and then in the level of the bladder, of course. So it is in order to facilitate drainage of urine through the aid of the gravity. So I have here the catheter, and I will put a lubricating jelly in order to be accessible to put inside the female urethra. Ano dito? Ibang konti. Sige, gusto na isip siya. Nakikinig places on. Alam mo naman dito. Parang naman dito. Dito. Uwi na lang. Dito ako. Ganyan po. Ganyan. Sige. Ganyan lang siya. Ganyan. So I will put the catheter bag or urine bag here. Imagine here. So I put the urine bag there. After putting the urine bag in the bedside of the patient, you need to attach the cord of the urine bag or the urinary catheterization in the thigh of the patient. Okay? So this is the imaginary or supposedly the thigh of the patient. So I put or attach the cord here. So that's all for urinary catheterization, but before that you need to discard this one, the sterile gloves, or you need to discard all your tools that you gather or that has been contaminated by the patient. Of course, last is for the evaluation. Assess for the color, odor, amount of urine, note for any complaints for pain and catheter site. It is in order to note any possible underlying condition that requires appropriate referral and management with the physician. And then after that, you need to document the procedure, done including the assessment findings, of course. So the rationale for that, it is in order to have accurate date for collaborative management and continuity of care. So always remember that documenting all the initial assessment or the assessment of your patients is necessary in order for something that may happen to your patient, you will be liable for that. Thank you.